Hello, I'm Dr. Pinkal Desai. I'm Associate Professor of Medicine at Weill Cornell Medical College, and my specialty is treating leukemias. Now, we know that patients who had previous exposure to chemotherapy or radiation, they're at higher risk of getting chemotherapy or getting AML and myelodysplastic syndrome. And we wanted to take a look at what do these patients get, and is it important, does the chemotherapy exposure in the past matter when you actually get leukemia? And there were several things we found. One is that there are certain chemotherapy types that might increase the risk of adverse biological characteristics when the AML and MDS is diagnosed. It's important to understand that. And secondly, there are actually subgroups that do better and some that don't. So we found that patients with TP53 mutations, they only are prognostic in people who have AML but have intermediate risk otherwise. But in people who are not intermediate risk, TP53 mutations don't matter. There are also several important things that we found, that radiation exposure alone does not increase biological risk. It does not decrease survival from leukemia, and should probably not be considered as a damaging therapy in terms of leukemia risk, while chemotherapy exposure does seem to increase biological risk and survival in some groups of patients.